Oh, good. There's a monitor. I was a little bit worried. So, in continuing with the tradition, how many of you have ever heard of WIC? Okay, great. So I'm going to talk about the National WIC Association's project called Community Partnerships for Healthy Mothers and Children. And first, I want to start a little bit talking about WIC, because most people have heard of WIC, but not necessarily everyone knows the level of detail of the services that WIC provides. So WIC is federally funded, and it is state and local run. So that presents barriers and opportunities to the work that we do. There are 4 main pillars of service. We provide nutrition education, breastfeeding education and support, referrals to healthcare and social services, and healthy foods to pregnant, postpartum women, breastfeeding women, and infants and children up to age 5. We'd like to see that up to age 6, and maybe we'll get that in the child nutrition bill this year. Who knows? Maybe, maybe not. But for now, it's up to age 5. Oh, no, I think it was just delayed. Oh, no, there it goes. Okay, so at the National WIC Association, we are the nonprofit education arm and advocacy voice of the WIC program. So because we are not actually the WIC program, we have a little bit more flexibility in the kinds of projects that we can pursue. So hence, we pursued this project to give agencies the opportunity to do some work that's outside of the scope of WIC, but then reinforces WIC. We're a membership association, and WIC agencies, so state and local agencies, make up the majority of our members. But if you all want to become a member, you're very welcome to. It's only $50. We're very cheap. But that said, even if you do not want to become a member and want to engage with WIC agencies, we encourage you to do so, because there are over 10,000 clinics across the country. So likely you have a WIC program in your community that could be a great partner for this project. And for those of you that are leading the project as a WIC agency, you know you're a great partner for this project. Oops. Okay. So we are, like our partners here, national partners, we're also focusing on increasing access to healthy food and beverage options. And the intervention that makes us unique is that we're focusing on increasing access to chronic disease prevention and management services as well. Our target population is women and young children, because it is the area of expertise of our programs. That said, we are implementing projects that impact the entire community, but with a specific focus on women and children. And our national partners include the American College of Obstetricians and Gynecologists. So we have decided together with ACOG that it is really critical to strengthen the connection between preventive health and clinical health and physicians and providers. So that has been really a wonderful partnership, and we've seen some great projects emerge from that in Cohort 1 and hopefully in Cohort 2. And then the Altarum Institute is our evaluation partner on this project. And then, of course, we're partnering with 32 local WIC agencies across the country. And I did not put the map on the slide, so I apologize. But we actually do have a map on our table, or it should be there. Quinny, is the map there? Yes. So if you'd like to see our map, it's out on the table where you can get information from each project. So what kind of makes our project unique is that in WIC, we primarily focus on direct services. We focus on the individual and interpersonal level of the social ecological model. What we're hoping to accomplish through this project is provide that full spectrum of support from the individual and the interpersonal level at the WIC clinic, and then beyond the WIC clinic in the community, at the other organizations and institutions, and at the public policy level in communities. So what we like to say is we're going beyond the clinic in supporting clients and community members at large. So why did we even consider doing something like this? Because our expertise is direct service. WIC is a trusted community resource. Most communities have a WIC office. WIC staff and clients have insights on community needs because they see the staff see the community every day, and the clients are part of the community, so they can offer a lot to these kinds of projects. The staff is knowledgeable on nutrition and breastfeeding. We have professional and paraprofessional staff that can really be helpful in thinking about systemic community problems related to nutrition and breastfeeding beyond the WIC site. And there are a lot of established community relationships that essentially just happen because you are a WIC site. So in WIC, because we offer healthy foods, many agencies have strong or okay relationships with vendors, with local grocers in the community. They offer also, there's an incentive to be a WIC certified vendor. And there's also many established partnerships with community organizations and healthcare through our referral networks, although in many cases they're not as strong as we'd like to see them. So this project gives us the opportunity to really solidify some of that. So I'm going to go through some of our PSC accomplishments today, our policy systems and environmental change accomplishments today. So the way that we had structured our project was that because this was all new to us, we didn't predefine objectives for folks, which was great because it allowed folks to be really community driven and choose their objectives based on what the community wanted, but it has also been challenging because it's really hard to keep track of like 60 objectives. But that said, we have some great accomplishments across many of them, and I've kind of listed them by themes here. But essentially, we've seen more fresh produce at local food banks. We've seen more healthy options in corner stores. We've seen farmers markets brought to the community. In one instance, they quantified the redemption of the WIC farmers market nutrition voucher from a 60% redemption to an 85% redemption by creating a new farmers market at the health department, and it brought in an additional $16,500 for farmers in the community, and then the WIC folks got those benefits for in the form of fruits and vegetables. We've seen community gardens established. We've seen referral networks strengthened, a resource navigator program established in one of our agencies that actually we're hoping can become a model for many other programs. They've developed a training manual and sort of how to set this up in your own clinic, in your own community. We've seen healthy menu changes and labeling, better signage and shelf talkers in stores to promote healthy foods and to improve the WIC shopping experience, which if any of you has ever had to experience, it can be very unpleasant. It can be very confusing and stigmatizing, and so we've had some good wins on that end. And then we've seen better access to free drinking water during the day at elementary schools. A gardening curriculum was implemented in elementary and preschools in one of our agencies, where this amazing partnership from this project that emerged, the farmers are actually teaching the gardening curriculum in the schools, which is really, really exciting. And it's more sustainable that way as well. We've seen designated healthy community spots, designated breastfeeding friendly spaces. One of our agencies reached out to over 500 businesses in the community, educating them about breastfeeding and what it means to be a breastfeeding friendly business, and established a designation. Some of our other agencies did similar work as well. We actually, I learned this morning this first bullet is incorrect. We have trained over 800 providers on WIC, breastfeeding, and/or cultural competency, sort of bridging that gap between prevention and clinical service. We've trained businesses and community members on WIC, breastfeeding, and cultural competency. One of our agencies had a breastfeeding summit, and one of our agencies had a food summit, which was really, it just kind of came together. We were so impressed. the agency from the Eastern Shore, they got the First Lady of Virginia to be their keynote speaker, and she talked all about all the initiatives that are going on in Virginia related to food and food policy, and they decided after that summit, they signed a resolution that they were going to continue to advocate for that work together because they had started this work as a coalition, and so it was kind of a culminating experience for them that was really exciting. And then we've also seen a couple of policies passed, which is remarkable considering how short the project was. So we were very impressed. There is a mobile vending ordinance passed eliminating barriers to selling fresh produce, and there was an ordinance establishing a tax credit for food outlets in food deserts. So for more information, you can visit our project website, which is fairly new, so we're still working through the kinks, but we have the success stories posted that you can go to. It's greaterwithwic.org, and then if you want more information, you can come to our breakout session tomorrow. We'll go over some, like the others will, some of more details of some of our subrecipients or some of our awardee success, and we'll also give some tips about how WIC can really be helpful and an asset in your community project.